Dirks is on a date with Trixie at the local fast food restaurant. Dirk starts to sweat and feels stomach pains. Too embarrassed to tell Trixie about his new Crohn's diagnosis, he abruptly leaves the table and runs to the bathroom.
Hi! I got you water.
Thank you.
How are you?
Good, how are you?
Good, it's so nice to see you. Happy Valentine's Day.
Happy Valentine's Day.
Oh my god, I love your new profile picture.
Thank you. It's my cat, Nemo.
I love cats, just like my sweater. Feel it.
Oh no. Oh no. Oh no. Oh no.
The components of the digestive system include the mouth, the esophagus, the stomach, the small intestine, and the large intestine. All of these components work together using the 6 different processes to absorb the required nutrients and excrete the waste products.
It is believed that a viral or bacterial infection of the GI tract causes foreign antigens, that are proteins, which present themselves on the host cell membrane and slowly initiate an immune response. Since there are fewer T regulatory lymphocytes, homeostasis is compromised because the adaptive immunity cannot be suppressed. This inability to suppress the immune response leads to GI tract cells being attacked, hence why Crohn's is an autoimmune disease. Homeostasis is being altered as a patient with Crohn's is no longer sufficiently absorbing nutrients required to maintain homeostasis. As a result, patients can easily become dehydrated and or malnourished.
Right around here. Not so good. I feel so crampy. It burns. Checking all these symptoms that come along with this. The nausea, the vomiting. Oh, who knew that there could be so much inside my stomach? It's the diarrhea. My date's outside. She probably knows I'm taking a deuce. Oh, the abdominal pain and the reduced appetite kills me. Oh, I know, but the only good thing about it is that you never have to worry about gaining any weight. Tell me about it. Oh, excuse me.
Yeah?
Can you pass me some toilet paper?
Yeah, for sure. Do you think this will be enough?
Oh, that's great.
Okay, there you go.
Thank you.
You're welcome. Well, thanks for shooting the group with me, if you know what I mean.
Yeah, thank you.
Well, have a good night and good luck with your date.
Thank you.
But you might want to know, you're in the ladies' washroom.
Oh, excuse me.
Whoop, there it is.
Crohn's disease is acting up.
Apparently.
Let me tell you about it.
Okay.
Crohn's disease is an autoimmune disorder that affects the digestive system anywhere from mouth to anus. Although the exact causes of Crohn's disease is uncertain, it is said to be associated with environmental factors, genetic factors, and immune response. A viral or bacterial infection is normally taken care of by the mucosal immune system. However, in Crohn's, the antigens cross the epithelium through M cells and are phagocytized by macrophages, which present antigens to the CD4+ T cells. A local inflammation in the large intestine is normally controlled by regulatory Th3 and T regulatory lymphocytes. In patients with Crohn's, there are decreased levels of regulatory T lymphocytes and increased productions of Th1 associated inflammatory cytokines such as TNF-alpha and INF-Y, interleukin-12, and interleukin-18. This decrease in regulatory T lymphocytes allows the immune system to attack the gastrointestinal tract. The increased expressions of adhesion molecules recruit more lymphocytes to be infected tissue of the large intestine, resulting in tissue inflammation. In Crohn's disease, the constant infiltration of large numbers of macrophages, monocytes, lymphocytes, and plasma cells cause acute inflammation, which causes different types of tissue damage in the GI tract. Prostaglandins can cause edema, vasodilation, and pain as well. There are various segments of the GI tract that can be affected, the large intestine being the most common. The full thickness of the bowel is usually affected in Crohn's, which is characterized as transmural. As a result, the affected area will inflame and the autoimmune system will respond by causing a fever to increase the immune response to fight infection. This will trigger the lymphocyte response, as discussed earlier, and can cause perforation or obstruction of the GI tract. There are mild, severe, or prolonged flare-ups associated with Crohn's disease, meaning there are periods of active and inactive inflammation.
Patients with Crohn's disease often suffer from malabsorption of nutrients, which can cause nutritional deficiencies of vitamin D, B12, and iron. There should be regular monitoring of these levels, as well as the client's bone density. Crohn's disease patients often suffer from severe diarrhea. Bile salts are known to inhibit sodium and water absorption and induce chloride and water secretion. All of these effects will be associated with watery diarrhea. Furthermore, diarrhea is known to be associated with ion transporters that are impaired, which will increase chloride ion secretion and or inhibit chloride and sodium absorption. The lack of absorption of ions is due to the inflammation, which impedes the ability of the GI tract to absorb nutrients. There are various segments of the GI tract that can be affected, the large intestines being the most common. The full thickness of the bowel is usually affected, which is characterized as transmural. As a result, the affected area will inflame and the autoimmune system will respond by causing a fever to increase the immune response to fight infection. This will trigger the lymphocyte response as discussed earlier and can cause perforation or obstruction of the GI tract. There are mild, severe, brief, or prolonged flare-ups associated with Crohn's disease, meaning there are periods of active and inactive inflammation. Crohn's can spread, obstruct, or perforate his large intestines. In time, Dirks may require surgery to remove part of his large intestine. Although Crohn's is a chronic illness, with proper management, Dirks can anticipate a relatively normal life.
Crohn's disease is a transmural autoimmune disorder that can affect all different parts of the GI tract. The body's inability to maintain homeostasis also leads to inflammation that further affects the decreased capability to digest and absorb food.